I work with people with communication difficulties and swallowing problems, so helping them just maximise their ability and achieve their potential in those areas. And then the other part of my job is working with the other clinical leads to look at the direction of travel for the learning disability team and to still work for getting the best for our clients locally. I was new into the role as a clinical lead about 1.5 years ago, and my line manager at the time suggested that I access the Mary Seacole programme. It helped me work on a transition project, so to help young people leaving children's services and transitioning into adult services. Often there's a gap in service provision, and that can be difficult for the clients, that can be difficult for their families. So I undertook a project to make that transition more seamless. I think my passion for speech and language therapy comes from the fact that I think communication is a basic human right, and I just think it's so important that people with learning disability have a voice. Supervising my team is actually one of my favourite parts of my job because I really enjoy developing people. No matter what age you are or what stage in your career you are, you still have something to offer and you can still shape the NHS going forward. I think a good leader is a good listener, develops the people around them, is caring and compassionate. And I think a good leader in the NHS is someone that puts the patient at the centre of things every time.
So I'm responsible for the services of design and delivery. Design is software architecture, it's web design, it's business analysis. So actually going and sitting down with the clinical staff and asking them what their problem is, asking them how to explain how we could perhaps improve it for them. And the development is the rolling the sleeves up and doing the programming to actually deliver the solutions. So the Mobile Working Programme is a massive programme, my first project, and it involved bringing tablet devices and mobile devices to staff who work out in the community with service users. So a trust-wide project, 800 tablets we had to get out to community staff, and the idea was to allow them to record clinical information with service users in a collaborative fashion and stop them doing as much travel. I've taken a lot of training courses, but it's not just about training. There's a lot of things that you do. I mean, conversations with colleagues, learning from people who are very experienced and very knowledgeable in their field is also very important. I think what motivates me to improve myself is I want to add the most value I can to the trust, and therefore the most value I can to the clinicians and to the service users. I want to help people to help other people, and I also know that mental health is seen as a little bit of, it's not as important as acute care perhaps, and I want to change that, and I realise I'm not going to be able to do that myself, and I would like Sheffield to be a pioneer in mental health care. I have a very good relationship with my colleagues, so I'm a little bit, I'm very humble and very honoured that they think that I deserve this award.
I joined the Trust 2 years ago, and when I joined it was a very transactional team, just basically putting in place whatever anybody wanted or asked for, and I've changed that into a strategic function, and to do that I put a business case to add staff to the team at a more strategic level and brought in new systems and processes. So we went from everything being paper-based and manual to bringing in electronic processes. For example, electronic tendering system. So we used to send out requests for tenders paper-based. We now do all that electronically and engage with our suppliers electronically. We've also invested in the team, not only new staff but existing staff, so I've really pushed to develop their skills and experience, so we've put in training programs for the staff. I also ask for customer feedback on any projects that I lead and share the feedback with the team, and that's been really positive. I always lead by example, so if I'm asking my team to do something, then I expect to do it myself and lead that. I think a good leader is being able to work with people, individuals and part of a team. I think people really need to trust you and trust your vision and the way you want to work.